How can immunotherapy be used to treat AML, and what are the most common side effects?
Immunotherapy for AML. We know that immunotherapy is effective in AML because for many patients, the only curative option for AML is stem cell transplant, which is a type of immunotherapy. So we know that because the only cure is through a type of immunotherapy, that other ways to harness the immune system have to be effective in this disease. However, it's been challenging to understand exactly which ways to harness the immune system that can be effective in AML. The most common side effects of immunotherapy are when the immune system starts causing reactions in the body. So this can take form in many different manifestations, such as attacking the GI tract or attacking the thyroid gland or attacking the heart. And we have become very good as oncologists in recognizing these side effects and how to interact and how to intervene on them.
The first question really is, where is immunotherapy being used and employed in acute myeloid leukemia? And immunotherapy has actually been used in leukemia, acute myeloid leukemia, for a number of years now in the form of bone marrow transplant. Really, an allogeneic stem cell transplant, bone marrow transplant, really fundamentally is a form of immunotherapy, where you get a donor's cells, you wipe out the patient's old immune system and hopefully wipe out any remaining leukemia. But even if there is a tiny bit left, you infuse donor cells that make a whole new immune system to clear out the bad leukemia cells. So fundamentally, bone marrow transplants, another term for that is allogeneic stem cell transplants, cells from somebody else, from a donor. That's fundamentally a form of immunotherapy. In terms of the side effects there, so bone marrow transplants, obviously, they do have a lot of side effects, and it's a very, I think it have to be a very thoughtful decision about whether to undertake a bone marrow transplant. But for our AML patients who are candidates and who are fit, who have higher risk or even intermediate risk forms of leukemia, of acute myeloid leukemia, the best chance for those patients to be cured is potentially to undergo a bone marrow transplant. And so if that's done, the side effects, there are multiple possible side effects. They include things like graft versus host disease, where the donor cells, you hope they kill off the bad leukemia cells, but they could attack the patient. They could also have side effects with the new immune system is weak, so there's risk of infection, and there's the risk of toxicity to organs. So there are many risks, but again, it's about carefully weighing the risks and benefits. In terms of where immunotherapy is being employed, outside of bone marrow transplants, that's still, I would say, for the most part, investigational in acute myeloid leukemia. And we can talk about some other areas in which that's being used and those specific side effects.